This is Simon. He's our clinic cat, and today I'm going to show you how we give him his meds every morning. So he takes these nice little tablets, and I know sometimes with kitty cats it's hard to pill them, so we just wanted to show you, give you some tips and tricks on how to do it. So with him, he's an older guy, but with kitty cats what we like to do is we put your fingers kind of in between where his cheekbones would be, because that way you can tilt his head back. And then with this hand, you have the pill in it. You kind of just open his lower jaw and pop it in the back of his mouth. And you want to close it to make sure he swallows. But if you give a nice little rub under his throat, and you can see he's licking at his lips, that's how we know he swallowed it. And then for our a little more not so happy kitties when it comes to pilling, we do use towels. And then we also sell these little pill poppers. This helps be able to get it in their mouth. So they aren't trying to bite you when they do it, or if you are nervous about having your fingers in there. So how we wrap them up is kind of swaddling them like a baby. So we'll want to open this up, put our kitty cat in there, and then you'll kind of want to bring it around his neck. That way he can't, use his paws, kind of like he was in the beginning, trying to swat at me. And this allows it so he isn't really moving around or being all squirrely. And so since he's all nice and snug, and these little pill poppers, they have a little, it's like a little syringe. So you want to pull this back, that way you can put the pill in it, which is this one, so it'll fit right in there. And then with him, so you'll want to hold it kind of like this, and then again, same technique, pull his head back. But this one you can kind of stick and then pop it in there. Once again, closing his mouth. Make sure he swallows. And then he's had his meds for this morning. But Simon also has glaucoma, so he does get eye drops. So for these, it's kind of the same technique. You will want to tilt his head back to make sure that they actually go into his eyes. So when you do these, what's easiest is if you try to actually get it in the inner corner, because then it'll kind of go into his eye. Oh, I know. So we'll go 1 drop, and then 2 drops. And then he has had his meds for this morning.
Good boy, Sime.